Hey guys, this is Brittany Duran, athletic trainer, active release technique provider over at Head to Toe Chiropractic and Sports Therapy. Today I want to talk to you guys a little bit about something that you guys see pretty often and we see pretty often, and that is the valgus knee collapse, this deal. When people squat and their knees come in, or even when they're just walking and their knee collapses in that way. First I want to talk about what that is, why that's bad, and then what we can do to help fix that. So what that really is when we're looking at this motion, it really is the relative position of the knee compared to the ankle and compared to the hip. Now we tend to see this a lot in women and people who are first time working out. Women, because our hips are a little bit wider naturally, so when the femur bone comes down onto the knee, instead of coming straight down like it does in most men, for women it can come in kind of angled like this, which just allows that collapse to happen a little more naturally. We see it in people who are first time working out because they just don't have the strength around their knee to keep it in a good position. So the reason that that's bad is when your knee is at that angle, what happens is, one, you take your knee joint, which looks like this is your femur, this is your tibia, and it moves like this. And what you're doing now, when you ride in that valgus, is you're doing this to your knee. So you're collapsing and crushing this part and opening up that part. Now these ligaments over here get stretched, and then you've got this cartilage, that meniscus, on top of that tibia bone, and now you're tipping this femur, putting pressure on it, and then moving it, and it's just grinding on that meniscus. It's grinding it, and it's also kind of pushing it out this way. The second thing that it does is your kneecap itself sits in the front here, and it's supposed to move up and down. It's embedded in your quad tendon, and it actually moves up and down this way. But when it rides at an angle, instead of straight up and down, again, it's sitting in its groove riding on the side. When you hear people with those crackly knees, that's what that is. That's that wearing away of that cartilage instead of sitting nice and smooth. Okay, so a couple things you guys can do to help, especially with people who are first time really getting into weight training for the first time, is when you squat. Now, we tell people, keep your knees out. But something that a lot of people do, their body cheats their way through it, and they do this, and we say, okay, that's fixed. But if you notice, I just rolled to the outside of my feet. So when you look from the side, so here, if I start here and you say push your knees out and I do this, you see that compared to my ankle, my knee is not actually pushed out. It's just the whole thing's tilted. But from the front, it looks like I just fixed that. The other thing we tell people is we have them like this and we tell them to turn their toes out more. Now, again, that looks like that fixes it. But if you turn to the side, this is me in the valgus collapse, you say turn your toes out. Again, that knee hasn't actually changed angles from the ankle and the hip. It's now just turned sideways. So from the front, that appears to have put my knees further apart, but in reality, that knee is in the same position it was. So a way that you guys can help fix this problem and make sure it's being done right is when you're cueing people, and you, instead of saying push the knees out, I think what would be better is to say use your hips, use your muscles, and pull those knees out. Now what you're going to get is an activation of these glutes, and they'll feel it. When you say, okay, I want you to use these muscles and pull the knees out, you're going to get an activation of the glutes, you're going to get a little tightness in the adductors, which is the whole point of getting this sectional rotation in the first place and getting those knees out, is to get these active in the squat. And then you want to watch their toes. So you'll see there'll be someone that goes, oh yeah, I pull them out, and then their toes come off the ground. And it's okay to have your weight not in your toes. Obviously we don't want it there, but they should keep their toes just in contact with the ground, just to make sure we're getting that true motion and not the rolling. Okay guys, hope that helps. Keep your eyes open for more videos to come.